IUPUI are conducting in-depth studies on COVID-19 and how it's playing out here in the state of Indiana. And today, for the first time, we learned that they started studying COVID and kids.
Our Jenny Runovich shows us tonight how and why these researchers are testing the infection rate for Hoosier children.
At Ivy Tech in Indianapolis and 14 other sites across the state Tuesday, long lines of COVID testing represent a new phase in Indiana's pandemic research, one that includes for the first time children ages 5 through 12.
It's important because we're kind of in the midst of the school year and there's talking about, opening, staying on e-learning, doing something hybrid. Having a good picture of what school-aged children in the state currently are in terms of their infection prevalence is important.
Researchers with IUPUI's Fairbanks School of Public Health already completed 2 coronavirus studies since April, providing a clearer snapshot of how far the virus has gotten into our communities over time. Not just daily case counts, but overall infection rates.
Cases really represent the tip of the iceberg. There's many more infections than cases. Cases are people who test and test positive. We know that there's a lot of people who are either infected and have no symptoms, and so they don't test, or they're infected and so mildly symptomatic that they don't choose to test.
In phase 3 of their study, 20,000 Hoosiers chosen at random will give nasal swabs and antibody blood samples. Children participating just get the nasal swabs. The results will add to what science already knows about kids and COVID.
Kids get infected. Kids can transmit that infection to others, but we know that kids are just at lower risk of particularly bad outcomes like needing to go to the hospital or being on a ventilator or dying.
Children were not included in previous studies because they were either on lockdown or not in school and therefore not in high-risk crowded settings. Now we expect to get a better look at how the virus impacts kids, their schools, their sports, their activities. The study's results should be out next week.
We're told 1,000 Hoosiers took part in this phase 3 study just today. It'll continue through Saturday. The results then will go over to the governor and state health leaders to help them make future decisions during this pandemic.